Hello everyone, I'm back again to discuss with you at We Health Today. I am by name Mr. Haruna Joshua. We are going to discuss a topic known as abdominal distension. Abdominal distension is a condition which occur either by the accumulation of gas, that is air, or accumulation of fluid within the abdominal cavity, which causes its extension beyond the limit or beyond the limitation. Causes of these abdominal distensions. Majorly, we have two causes of this abdominal distension, which are: one, organic causes. Two, we have functional causes. Now, organic causes, which are pregnancy, is one of the organic cause that causes abdominal distension. Secondly, we have menstruation. So when it is menstrual period, to some women or some ladies, they experience abdominal distension. And we have weight gain. Weight gain. So when an individual is gaining weight, there is every tendency the abdomen gets distend, or the abdomen distend. So these are the organic causes of abdominal distension. And we have the functional causes of abdominal distension, in which here is where we need to pay much attention. Children can present abdominal distension. Adolescents can present abdominal distension. And adults can present abdominal distension. Now, both female and men of all this age can present, or all this stage can present abdominal distension. What are these? Functional abdominal distension. This functional abdominal distension are talking about the function of an organs within the abdominal cavity. Yes, they are talking about the well functions of an organ within the abdominal cavity. So when now you see the abdomen is being distended, now is a signal or sign that is telling you something is going wrong within the abdominal cavity beyond the illness that you are seeing. That there is something within the abdominal cavity, meaning is telling you that the dysfunction of an organ is occurring within the abdominal cavity rather than the illness of that individual. The malfunction of an organ within the abdominal cavity has occurred. That is why it presents the illness that you are seeing. That person is ill, that person is sick, that person is not mobile. So, is where we need to take much attention and action to save a soul or life of someone with this presentation of the distended abdomen conditions. The causes, we said functional causes. These are abdominal disorders which are being stated organ by organ. That is, if we are going to mention it, we cannot even quantify today. But in accumulation of when what is what the presentation of malfunction of an organ within the abdominal content. This is what we are talking about in simple form. The diseases of the stomach can be the cause of abdominal distension. The diseases of gallbladder can be one of abdominal distension. The diseases of gout can be the presentation of abdominal distension. The diseases of large or small intestine can be the cause of abdominal distension. The diseases of liver can be another cause. The diseases of kidneys or urinary bladder can be another cause of abdominal distension. We have descending and ascending diseases can cause it. Disease of the heart can cause it. Diseases of the lungs can cause it. Diseases again of what? Either artery or vein can still cause it. The obstruction can cause it. If there is any obstruction within the abdominal cavity, can cause it. And then we have constipation, can cause it. I'm now breaking it again. Constipation can cause it. Liver cirrhosis can cause it. Hepatitis can cause liver cirrhosis. And this liver cirrhosis can cause abdominal distension because it can lead to affection of what? The gut of the stomach. Yes. Gastritis can cause it. Accumulation of gas within the content. And we have accumulation of fluid within the content. If there is any escape of fluid within the abdominal content, it will be what? Accumulating. It will be accumulating. Before you know, the abdomen will start distending. The abdomen will be distending. The abdomen will be distending. So there are many more causes of this abdominal distension that we need to pay attention and take note if someone presents abdominal distension. So, sign and symptoms. The sign and symptoms of abdominal distension. The major sign that we see is what? The lightening of the abdomen. The abdomen will be showing light. It will be more lighter. The abdominal cavity will be more lighter. It will be showing more lighter, which tells you that there is a problem in the abdomen. And restlessness can be the sign and symptom of abdominal distension. And at the same time, we have pain. The pain can be acute. The pain can be severe. The pain can be mild. But pain is presenting the sign and symptoms of abdominal distension. And we have nausea. Now, this nausea might lead to what? Vomiting. Nausea might lead to vomiting, which is the sign and symptoms. Now, in case this vomitus comes out or leads to vomiting, observe the vomitus. The color of the vomitus matters. Which color does it present? Yellowish color, reddish color, blue color, dark color, green color, whatsoever, ash color. It might be food that you take. It might be some chemical. It might be some chemical. It might be disease condition, malfunction of an organ. So in this case, you again observe the smelling of this content or vomitus. That is the odor it presents. How does it smells? How is the presentation of the smelling of this vomitus are? Or is it will help to detect the key points of causative agents of this abdominal distension. Is a great sign and symptom. reddish color, yellowish color, sorry, of the eye. The eye might present yellowish color. It sends signal to you something is happening at the abdominal structures. When you see the abdomen being distended and you see the eye yellowish color, is another thing telling you. And if you see the vomitors coming out with blood, it's still telling you something is going wrong. The vomitors coming yellowish, it's still telling you that something is going wrong. All are signs and symptoms of this distended abdomen. The diagnostic measure. The diagnostic measure of this abdominal distension, the major diagnostic measure is to know the causative agent of this abdominal distension. Once you know the the causative agent of this abdominal distension, what causes this distension, then it's very easier for you to face your diagnosis of this patient, and it's very easier for you to take measure of this diagnosis. So let's get this in our heart. Once again, I mentioned it earlier, but I am still repeating it for you to know it very well. Abdominal distension is a condition in which is showing you the signs and the elements that there is malfunction of an organ within the abdominal cavity, rather than the presentation of the illness that you are seeing. That the distension of an abdominal cavity that your eyes is seeing, there is malfunction, inability of an organ to perform its activities the way it's supposed to be, rather than the illness, the lying down of the bed, or inability of that person to walk, that this your eye is seeing. So it calls for great attention in order to take care and take monitoring of that person to help him out of that condition. What are the risk factors of this abdominal distension? What are the risk factors? Inability of an individual to take care or to treat this abdominal distension causes abdominal burst. The abdomen will what? Burst. And that is all. Once the abdomen bursts, boom, that is all. It has gone. And it leads to surgery. It leads to surgery when now it is an obstruction. And there is no two ways about obstruction rather than to what? Open that person in order to what? To remove those content that causes obstruction, as long as the lactulose supplements cannot subsidize it. And at the same time, it causes paralysis, mild paralysis or partial paralysis of what? Digestive system. It causes partial paralysis of the digestive system. And at the same time, it causes damages to the what? Abdominal cavity. When it causes damages to abdominal cavities, there is any tendency lose of life. There is every tendency lose of life. The liver damage, the gut damage, intestine damage, stomach damage, kidney damage, and others damage. Definitely, there will be in supply of blood to what? To the structures of the abdominal cavity, because the damages has been taking place, causing the malfunction. And if this malfunction extend its limit again, definitely no option rather than to what? Life to go. So we need to take care or take note of this abdominal distension. Thank you very much. If you have question, more elaboration, more advice, let's meet at the comment section. And if you need more details, let's meet at the comment section. You see your details over there. Thank you. I remain Mr. Haruna Joshua at We Health Today. Don't forget to follow our page, like our page, press the comment button, say a word, criticize, amend, ask question, advice, comment, and share so that others might partake on the Health Today. Thank you.